Hi everyone, welcome to Coffee and Chat. I'm Jenny. So this is your first time to Coffee and Chat. I would encourage you to watch the introductory video where you're going to learn a little bit about myself, my background, and you're going to learn a little bit about what Coffee and Chat is all about. That way you can decide whether or not it's something that you'd like to tune into. However, if you are a friend returning for a visit, you know the drill. Get your coffee, get comfy, and let's chat. This is part 2 of the Concussions 101 series, and it's a continuation of where we left off from Concussions 101 part 1. It's probably a good idea to watch the previous video so that this chat will flow better and you will, it'll make more sense. Okay, so I left off where I started sharing some of my thoughts about concussions. And my first point was that everyone, that's what I think anyway, that everyone should read up on this injury and learn more about it because there's more to it than the average person thinks. So here we go with a few more suggestions, which will be followed by some helpful tips for concussion recovery. Okay, number 2, whenever you think there's a potential injury to the brain, always get it checked out. When in doubt, get it checked out. Concussions are most dangerous to children, to teenagers, and older adults. And according to what I've been reading, the best chances of full recovery is for people between the ages of 18 and 34. But having said that, regardless of your age, you should still take potential head injuries seriously. Don't mess around with that. Get it checked out. Follow the recommended protocols and pay close attention to how you're feeling or how the other person's feeling throughout the recovery. Number 3, I mentioned before, you don't have to hit your head to get a concussion. This can happen when you get a blow to another part of your body as long as the required force is present, or if you get shaken vigorously. In my case, I was sitting in my car on the shoulder of the highway and I got sideswiped by another vehicle who was traveling at highway speed. So he was going like well over 100 kilometers per hour. I didn't hit my head anywhere, but my head was shaken so vigorously. Like I went from side to side to side to side, I don't know how many times. And I just remember to this day, I remember the sensation of feeling like my head was going to pop off my body. So now my understanding, what happened there was even if my head didn't impact any part of the car, my brain, which is like if you think about Jello in a bowl, my brain would be the Jello, the bowl would be my skull, and it was just like if you took this bowl of Jello and just shook it from side to side like a bunch of times hard. That's what happened to my brain. So it kept going side to side. It didn't hit, my head didn't hit anything, but my brain certainly went for a ride in my skull and it got swished around in there quite a few times. And that was turned out to be my worst concussion ever. With the, like I said, I'm still suffering from symptoms 6 years down the line. Number 4, use your intuition and common sense at all times. You know yourself, you know your children, and you know your loved ones. You need to advocate for them. Pay attention to what's going on and trust your intuition, okay? If you seek medical help for yourself or a loved one after an incident and they tell you something that doesn't sit well with you, get a second opinion. Case in point, my son got a concussion when he was 17 during a basketball tournament. So he collided with another player going up for a jump shot. On his way down, his head hit the player's knee and then he fell. When his head hit the player's knee, I think he became unconscious and he fell on the court face down and he was knocked out cold. So he was taken to emergency by ambulance. The attending physician in emergency, I guess I'm assuming they did a CT scan, because it's like I was at work, I got the call, panicking, and by the time we got there, he was talking and everything, but I don't remember. I'm assuming that they did a CT scan, which is what they normally would do in these types of situations, especially where there is an impact to the head. So this is the emergency physician. She told us, me and my husband, that he had a mild concussion And then she told us that she thought that he would be okay to resume, like to go back to the tournament and play in the tournament the next day. Yeah, I wasn't happy with that. I was actually quite upset with that. But and of course, you know, as an eager young man, he wanted to go back to the game the next day because the doctor told him that he could. So I said no. We said no. And luckily, his coaches knew better, and they were, you know, well versed in concussion rehab and the protocol. So they wouldn't have let him return to the game the next day. But if I didn't know better, and they didn't know better, he could have very well gone back in to the tournament to play again. So I actually got a second opinion from his pediatrician. I called her, and she was more livid than I was, because she said, first of all, it wasn't a mild concussion. He lost consciousness and there was impact. And secondly, when you have a concussion, this was his second concussion because he had one a few years back. Secondly, when you have a concussion, there is a protocol that you have to follow before you get back to normal activity. And also there is a window of, for lack of a better term, it's not opportunity, but there's a window. I think there's a 48-hour window where after you've sustained a concussion, where if you get another concussion, that could be like serious. That could lead to like serious issues, right? Later on. So the fact that this physician, this doctor, didn't take these things into consideration and just kind of basically said, yeah, he can play. He can go back to the tournament tomorrow. That made me really angry, because this is a doctor. We brought our child to you because we expect to get the best trained diagnosis and treatment for our son. And here you are telling us that, yeah, it's okay. He's fine. He can go back into play. So, you know, and this is nothing, in all fairness, I want to say that one of the things I've learned is that there's a lot of research about concussion, but from my understanding, research, it takes like 15 to 20 years before it gets into the textbooks, into the medical, you know, arena, so to speak. So, in all fairness, maybe she wasn't, you know, up to speed on the latest treatments, the latest protocols with concussion. But nonetheless, as I said, that's why it's so important for you as an individual to take control, and for you to know what is going on out there, so that when in doubt, you can check it out, do some further research, because our children and our health is basically up to us, right? We have medical professionals out there who are going to, of course, they're going to do their best, but really the onus is on us to know how we function, and we have to take that responsibility. If we don't think that somebody's giving us the best advice, then it's up to us to really advocate for ourselves and research further. Okay, so that is hugely important, and I'll probably talk about this. I'll say this more often in more chats, because that's one of the things that I've learned throughout my lifetime. It's that we can't just sit around, and especially when it comes to our health and well-being, we can't sit around and leave the responsibility up to everybody else. We have to take that we have to be proactive when it comes to our health care and when it comes to being responsible for ourselves. So, number 4. Concussions are usually associated with whiplash, which is an injury to the muscles, tendons, and ligaments of the neck and the cervical spine. And apparently, this is something I didn't know either, the symptoms caused by concussions can also be produced by whiplash. I didn't know that. So even after the concussion is healed, Since soft tissue injuries, like to the ligaments and tendons and soft tissue, these usually take longer to heal. So the symptoms can persist, which is usually why some people end up with persistent concussion symptoms. And finally, number 5, concussion affects blood flow to your brain and therefore other parts of the body. And when that happens, everything is affected. Cognition, mental activity, physical activity, hormonal activity, which then affects your moods, anxiety and depression. Also a very common side effect of concussions. Concussions, like when there's problems with the blood flow in your, like to different parts of your body, this can cause a buildup of inflammation in the body. Concussions it also affects your digestion because there's apparently a brain-gut connection, which I didn't know about. Concussions can also cause visual and vestibular disturbances or balance issues, and the list goes on. Okay, like for each person, I may experience certain symptoms, somebody else may experience symptoms that are different, but there's a whole umbrella and list of symptoms and effects that concussions can have on people, and different people may present differently. At the end of the day, a lot of body functions can be impacted. There's so much more to discuss, but it would take me too long, and I don't have the scientific or rehab background to do the information justice. So that's why I encourage you again to take some time to check out the research that's out there. And once again, CCMI, the concussion doc, Dr. Cameron Marshall, is a great place to start. And just one more thing, I want to mention that regarding some helpful things that you should know if you or someone you know gets concussed. Be familiar with emergency procedures if you suspect a concussion. Again, it doesn't have to be a hit to the head. When in doubt, get it checked out. If you decide not to go to emerge, then in the first 24 hours, you need someone to keep a close eye on you. And you need to be woken up every couple of hours. Watch out for vomiting, excessive sleepiness, slurred speech, and balance problems. Again, these are just some of the symptoms to look for, but please look it up for more details, okay? Once you've been diagnosed with a concussion, there are some supplements that the body needs in order to help the healing process along. Now, here are some of the ones that I was told to take, which helped me immensely. Omega-3s. These are fatty acids in the form of an oil or capsules. Specifically, you need one with high amounts of DHA. I'm not going to try to pronounce the actual term for that. It's some sort of the acid. I was told to take between 1,000 to 1,500 milligrams a day. Of course, please consult a certified professional for your specific needs. I found some of the nutritionists at Healthy Planet to be very helpful, but you know, it would be worth your while to seek help from a holistic nutritionist, or if you have a doctor, an MD who's up on the latest holistic treatments, that would be recommended as well. So the omega acids also, the omega-3s also have something called, it's a fatty acid called EPA, and this is also important because it's another acid, a fatty acid that helps to reduce pain and inflammation. Second supplement, creatine. Creatine is an amino acid that's really good for brain health. Third, you want vitamin B12, which is and you need that in a fairly high dose. I took between 3,000 to 5,000 milligrams a day, but that's for me. Again, you need to consult a professional, a certified professional, to help you determine what dosage you should be taking. Probiotics, as I mentioned, there's a brain-gut connection, and when you get when you have a concussion, it affects your digestion in ways where I'm not going to get into because that's too scientific. But if you watch the webinar that is hosted by the concussion doc, they will explain all of these things, and he does so more scientifically and better than I would. So, but probiotics is something else that's often prescribed when you're trying to recover from a concussion. Magnesium, that's it's a mineral or it's a supplement. I took the glycinate, which is in a liquid form. Whenever you're taking supplements, it's always recommended to take the liquid because it gets absorbed into your bloodstream, so it's a faster absorption and quicker reaction. Vitamin D, again, consult a holistic nutritionist for the dosages. Stay away from refined sugars, processed foods, caffeine. That's why I have to have water. I can't have caffeine, but the water's good. It's really good when you're thirsty. Drink lots of water, get plenty of rest, stay away from electronics, which I'm not really doing right now. That's why these are one of the things that triggered the post-concussive symptoms. When I was doing the first 2 episodes, I spent a lot of time taping and then editing. So this prolonged screen time, and also talking, right? That's another thing. So stay away from electronics, computers, cell phones, televisions, any type of screens that includes video gaming. Low intensity aerobic activity is very good because it helps to get the blood flowing. If you think about it and you have blood flow interruptions, you need to keep active, but you don't want to do anything that's super intense because you might pass out, and it just doesn't help, right? So anything that's low intensity, like walking. If you're working with a rehab professional, they'll tell you what intensity you should be doing these activities at. Next, manage stress. That's huge because your whole nervous system, when you have a concussion, gets into an uproar. The parasympathetic nervous system, which is a fight or flight mechanism, it gets overstimulated, so you really have to work on managing your stress and keeping your relaxation, meditation. You really have to work on keeping your stress levels down. And of course, rehab in the form of chiro. I know a lot of people are not big on chiropractors, but as I said, the chiropractor who helped me initially was a godsend, and without her, I don't know how I would have gotten through the process, because I'll tell you more. I'll save everything about my journey for the next session. But massage, physiotherapy, there are other therapies that might be needed, such as vestibular therapy. But these things are sort of supplemental to the things that I mentioned before, which is the activity, the supplementation, the meditation, because you really have to get your system calm. You have to calm down your system first before you try to go and do these other therapies, because if your system's not calm, you try to go and do anything else, you will probably not get desired results. And last but not least, a supportive network of people who understand concussions, who understand concussion rehab and management, or who are at least willing to learn about it. Okay. Again, these are things that I learned from my concussion journey, and there's so much more. I mentioned earlier about CCMI and Dr. Cameron Marshall, the concussion doc. I will put, again, his information in the description. The seminars, the webinars that he hosts, amazing. If you do nothing else and you just watch one of his webinars, that will give you a lot of useful information. So I think that would be helpful, and I'm not getting any proceeds from this. I'm not, this is just something that I found later on that I found to be really helpful, and I just want to share it with you, and in hopes that it might help you someday, or somebody that you know or love. Now, as someone who has dealt with practically all of the systems and establishments associated with concussion care and recovery for the past 5.5 years and counting, take it from me, you'll get some useful information from, just like I said, with the webinar. And they also offer an online program called Concussion Fix that you can enroll in if you need help dealing with persistent concussive symptoms. I just want to add that this is not the only concussion program there is out there, but this is the one that resonated with me. And as I said, I had great success when my concussion was acute from a chiropractor who was affiliated with CCMI. So that's why I'm speaking so highly of them. Okay, so I'm going to stop here for today. My main message, the main takeaway from this talk today is research concussions. Please, 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 please research concussions. Okay? On my next chat, as promised, I'll share my experience with persistent concussive symptoms, aka Post Concussion Syndrome. And after that, I'll get back to my the chats that I was talking about initially. Social media, I want to talk about the family, I want to talk about relationships, and so much more. So I hope this was helpful. I hope you got some information from what I shared with you today. I hope that before you view my next chat on post-concussion syndrome, you will have done a little bit of research yourself about concussions. All right, so goodbye for now, and see you next time on Coffee and Chat. Follow the recommended protocols and pay close attention